What sets the fast track at Implant Pathway apart from any other continuing education event is that our doctors are very committed. They are coming here for an entire week. They're coming out of their practice, they're paying for the course, but in the course of this week, on top of the foundational modules that we've given them, we're going to come in, we're going to teach them the didactics they need to know, we're going to get the reps on the models, and then we're going to go into the clinic on Wednesday, Thursday, and Friday and treat patients with their mentor over their shoulder, and they're going to emerge out of this week, I think, confident to be able to place single implants in abundant bone on healthy individuals, to be able to extract and graft and set these patients up for future implants, and to have a great treatment planning knowledge. That's what sets us apart. I think probably the three main benefits to taking an implant fast track is that you get it all at one time. And if you take it over numerous weekends and numerous months, like, you're never able to put it like kind of all together. So benefit number one is like, come, get the training, and go home and do it Monday morning. Like, that's what we teach, that's what we preach to it. Benefit number two is you get to work with not just one mentor, but probably 4 to 6 of the mentors that are there, because we rotate every half day so that you get exposed to new people and new ideas, because not everybody sutures the same, but the outcome is going to be the same. It's going to get closed. And then the third benefit is the family. Like, you become part of the implant family, Implant Pathway family. You get the mentors and my personal contact information, and that learning continues on long after the course. Doctors that leave the Implant Fast Track course will have a level of confidence that I don't think you'll get anywhere else with any other kind of program, and that is, we've taken them through the scary things with their mentor over their shoulder, doing the first implant, doing the first suturing, things like that. We've given them a great foundation to understand, is our patient even healthy enough to be able to have this kind of treatment, so that we can give them more initial success, because we're working on people that have the right treatment plans for the procedures. And then, they also get to talk and meet the other attendees that are at the course. And this is invaluable, because many of the OG mentors that we have here, I met at courses, and I've stayed friends with them ever since. So, like, those are like real, those are like the real nuggets of Implant Pathway. Yeah, your learning and your support from Implant Pathway doesn't end at the end of the course. Obviously, they have all of my contact information, cell phone, emails, such. They have that of the mentors as well. But we have an online platform. I think we call it the Study Club or online platform. It's a place where we have follow-up contact with the attendees. So we have a weekly seminar series. So we have webinars that they do for continuing education hours. We've got forums in a number of different categories. So the mentors, myself, like, we post our cases online. The docs can come in, they can look, they can comment, they can post themselves. And it's a very safe place. Like, there's no lurkers. It's not Facebook. It's not these things. It's a very safe place. We do an annual symposium where we have speakers come and hands-on workshops, and they can come and interact again. And now what's really great about the symposium is you start to see people coming back in the same cohorts that they did a fast track with. They met them, they stayed in touch, like, hey, I'm going to go to symposium, they're going to meet up, they go out to eat, they go to our events, and then, we're always evolving our online modules, and when we put new modules out, we just send it out to the alumni. I'm a firm believer at Pathway, like, it's not about the money. We all get to make a living, but it's about connecting people. and showing people what they can do. I think someone that is on the fence on taking Implant Pathway Fast Track is probably looking at it like, I got to take a week off of work, which I think that's what makes Fast Track doctors shine just a little bit more, because there's a commitment level for taking a week out of your practice. I mean, there's a financial commitment to that. I think others that, kind of are on the fence is like, it's got to test them. Like a week long, being away from home for a week, and it's tougher too, because some of the docs, they, especially those that have small children. I mean, it's a long time away, and it's a bigger commitment than doing it over the weekends. But there's a number of different things that might be, going through their mind. All I can tell them is like, it it's the it's the most focused, direct path to implementing implant dentistry into your practice that's available today.